Diseases that have traditionally been endemic in our country now, being more than 4 times the previous rates. For instance, I'll give you tuberculosis. Before independence, we had notification rates of about 100 per 100,000. Now you're talking about something in excess of 500 per 100,000. So that's more than 4 or 5 times increase in the number of these opportunistic infections. If you look at a constricting budget, national budget, because you have to impress the International Monetary Fund, World Bank, the budget for health has been constricted while the disease burden has literally increased. Health workers themselves have not been spared of HIV, and I think the attrition rate in the health sector is about 37%. So if you look at a constricting workforce, others leaving for greener pastures, the economy collapsing as a result of agriculturists who are dying, the economy is dying, then you really look at a time bomb. I think we have had it as far as HIV is concerned in the health sector. And then, of course, monies which could be channeled to other businesses are being spent on buying drugs that have to cure these opportunistic infections. So it's a vicious cycle. So I would say HIV has worsened our poverty, and that has increased the number of admissions in most of these wards. Yeah.
How have you gotten access to ART?
2 ways. First, in 2002, I think the Zambian government made a decision that they were going to start giving ARVs to the Zambian people, regardless of what the donors felt. Because at the time, the donors were of the view that Zambia wasn't able to sustain an ARV program. So in 2002, there was a ministerial statement that we were supposed to start ARVs. The target was to put 10,000 people initially on ARVs using government funds. And that time, government committed $3 million of our national money and bought the first ARVs. But obviously, after the 3x5 WHO initiative, a lot of other funds or donors through the global funds, World Health Organization, have come on board, and now we are targeting 100,000 people on ARVs by 2005. That's the end of this year. So there's been a lot of government commitment as well as multi or collateral funding from the donors. If you put it this way, frustrations, right? For any well-trained profession, you want to do things in the standard way, okay? If, for instance, I was to practice medicine the way I've been trained, I'll probably hardly practice anything here. See, what would happen is, if let's say, I'll give you a simple thing, like I want to do a lumbar puncture, okay? What does it entail? If I'm in the States or the United Kingdom, I would want a lumbar puncture set, okay? But here, I won't find it. Probably if there is one, I reserve it for showing my students that this is the ideal set. So what do? Okay, so it means you start improvising. It means I'm going to use a 18G cannula to do a lumbar puncture. I just swab and I do it, you see. So sometimes you wish you could do more for your patients, but you can only do so much because of this poverty that is there. There are two things here. If you look at the general population, the early figures ranged from 20% to 37%. Now, if you look at selected populations, like antenatal women, the rates are about 25%. If you look at the general population, the figures have dropped. We are now at about 16% national prevalence rates. Okay, so the figures have been dropping. If you look at hospitalized medical patients, it's as high, if we use the TB cases, it's as high as 70% of our TB patients who are here having HIV. So I can safely estimate that between 60 and 70% of our patients are HIV.